Health Insurance Portability and Accountability Act is a privacy rule that protects patient confidentiality and the security of patient data. Protected health information cannot be disclosed to anyone who is not involved in the care of the patient. HIPAA makes it harder to access patient data, increases the amount of time it takes to be granted access to patient information, and restricts the amount of people who have access to protected health information. Here is an example of one of the ways that HIPAA limits who can and cannot view a patient's file.
I'm having a hard time with this patient. I just don't know what to do.
Maybe I can help out. I will just take a look at the patient's file and see if I have a suggestion.
This is a HIPAA violation. Because this nurse was not assigned to the care of the patient, she does not have the authority to access their medical record, even if she had good intentions. HIPAA does not necessarily improve efficiency, but it does decrease the likelihood of errors in the healthcare system, which in turn improves patient care. The next example shows how HIPAA improves patient care by preventing the unnecessary disclosure of patient data.
Mrs. Smith, what a nice surprise. How are you today?
I'm fine.
So I see here in all this. You'll never guess who came in today. Mrs. Smith. It was so great to see her, even though her blood pressure is really high.
This is a HIPAA violation. The nurse has just disclosed protected health information to an outsider who has no rights to the patient data. Now let's look at an example of how nurses are impacted by HIPAA. This is a HIPAA violation. Patient information must never be left in a place where the public could see it. Nurses must never be careless with where they place patient information. Another thing that nurses need to know about HIPAA is that there are special circumstances in which they are required to report information about a patient. Suspected abuse must be reported. Abuse is not protected health information and will not result in a violation of HIPAA. Nurses have been greatly impacted by the Health Insurance Portability and Accountability Act. They must be extremely cautious with patient data. Revealing protected health information is a serious offense, and only healthcare workers who are assigned to a patient have access to that patient's information. Patients are also impacted by HIPAA. The rules and procedures benefit patients by giving them more privacy and by protecting their information. HIPAA has influenced the healthcare system, its workers, and its patients in many ways by limiting the people who have access to protected health information. This helps reduce the amount of errors that occur and ensures that patients are receiving the best possible care.